Does that all work?
Perfect.
Is my presentation showing up and everything?
Yes, you're good.
Okay, wonderful. I'm ready. Let me know when I can start.
Perfect. So Leo is a current PhD student at Winchester, researching the relationship between coloniality and the medical curriculum, looking at what it means to decolonize the medical curriculum. And they will be talking today on the gender binary and the role of gender identity clinics. Over to you.
Thank you. So I'm a first year PhD student in the Faculty of Health and Wellbeing. I'm actually kind of doing a bit more of an anti-colonial and anti-capitalist critique of some aspects of medical education. And I have a particular interest in how oppression and marginalization that exist in society is created and reinforced through medical education and through medicine in general. So this presentation is going to explore some issues related to trans healthcare and the existence of trans people in Britain. There are some limited references to transphobia, misogyny, and racism. So why am I doing this? Trans people are a marginalised and oppressed minority who face barriers to healthcare. There have been some improvements in this, but the move towards affirming consent-based models of trans healthcare has been slow, uneven, and marked by an ongoing tension. And I am really interested in that tension. Where does it come from? Why does it persist? And in this paper, I'm going to offer a Marxist feminist critique of trans healthcare in Britain, and I'm going to argue that its failures are inevitable and in fact necessary under capitalism. So let's break that down. So gender in Britain is generally understood both as an oppositional binary, so women and men, and resulting from biological sex, so female and male. However, this is a social construction and not a biological fact. Sex is in fact a collection of dimorphic traits, for example, chromosomes, gonads, external genitals, other reproductive organs, levels of sex hormones, other characteristics. These things are variable both within one person over the course of their lifetime and across the population in general. And they may or may not align with what is kind of considered male or female in one person at any one time, as is the case with intersex people or transgender people or lots of cis people. For sex to be used as a dichotomous classification, all of those indicators have to be reduced to just one. So that's M or F, right? And that's a social process. There's no essence underlying sex. And we are taught, in society that there exists entirely outside of society and indeed in existence before it, a natural division between these sexes. And it's that natural division that has social consequences. However, that division of men from women is a political and economic project. It's not a natural one. And indeed, we can kind of see this through increasing knowledge of the complexity of the biological basis for sex and gender, and attempts to reflect this fluidity in social practice have been generally met with opposition and haven't meaningfully disrupted the hegemony of the gender binary. It's also the case that the sorting of these people into two categories comes with expectations about how they should behave, about what constitutes masculinity or femininity, and what relationships between people are then considered natural and normal. However, this structure, this division, actually creates the content of those categories and not just their relationship. So it's not like there is this sort of, this is what femininity is, this is what masculinity is, and then we just know how those two things interact. Well, no, that the categorization creates the content of those categories. And again, you can kind of see that when families and people who exist outside these norms are widely disparaged and distrusted. It's also really important to note that the sex gender binary is also inherently part of a project of white supremacy. From the earliest consideration study of the sex binary, the supposed extent of the difference between the sexes was considered to be a marker of their racial development. So the sex gender difference that is supposedly displayed fully by only the European heterosexual couple serves as an ideal against which to measure all races. So this whole thing is sort of steeped in racism. It's steeped in white supremacy. So I needed a theory of gender in order to kind of start doing some analysis and then think about the experiences of transgender people. I wanted a theory of gender, and I'm drawing here on Marxist feminism. What's Marxist about it? Well, it's grounded in a theorization in economic conditions that exist in society. And in order to develop this praxis towards liberation for women, trans and gender non-conforming people, Marxist feminists have focused on the ways that sex and gender functions to uphold and reinforce capitalism, rather than locating the source of gender-based oppression in biology, which, as shown, is an ideological and social construct. The material roots of this oppression lie in the relationship of the heteronormative household to capital and the need to produce the next generation of exploitable workers. So, here are some theories. Labour under capitalism is gendered. So labour associated with women is more domestic in nature. It's often in support of more male-coded work or associated with male-coded professions, like doctors and nurses, for example. I'm sure you can all think of loads of examples of that. Women are paid less. They are more likely to be involved in work that is reproducing the worker than in profit-generating labour. And this categorization of labour also intersects with race. So low-status gendered labour falls disproportionately on people from racially oppressed communities. There are many examples of that. For example, people who are cleaners in hospitals, cleaners in workplaces, street cleaners, things like that. So, why? Well, what Marxist feminists kind of have said is that what's really interesting is, and what goes unsaid in sort of Marx's work, is what happens to the worker when they leave work and how they have to get back to work the next day. So this kind of is thinking about what happens after you leave work at 5 o'clock, and what gets you into a position to return to work at 9 a.m. the next day. What has to happen is that the worker has to be reproduced on a daily and generational level. It's really vital that this happens. Workplaces depend upon it. This reproduction can take place outside households, but it massively, overwhelmingly takes place within the heterosexual family. So overwhelmingly, people who leave work will go home to some form of heterosexual family, who will then have their needs met in some way to return to work the next day. This labour, this reproductive labour, disproportionately falls on non-men for the benefit of men. So you can see there's lots of these two references here show that women do most of the reproductive labour in households, most of the cleaning, most of the cooking, most of the childcare, all that kind of stuff falls to women, and it falls to women whether they also work outside the home or not. And one of those studies is actually fascinating because it's about the experience of women during the pandemic in Britain. And even though everyone was at home, that labour still disproportionately fell onto women. So what happens in families, like in this family structure, and to the people that constitute them, is of great interest to capitalism, because any systemic changes to heterosexuality or the gender binary would be accompanied by a loss in profits, because aside from the domestic and low status labour no longer falling onto women, as that category would not exist, capitalists would no longer benefit from things like the gender pay gap, where women get paid less for their work. So, conclusion of this part is gender binary, super important for the maintenance of capitalism. How does this fit with the experience of transgender people trying to access gender affirming care? So I'm now going to look at the condition of trans people under capitalism and looking directly at trans healthcare. And I'm going to consider the ways in which this task is constrained, given that the purpose of this task is to oppose that binary system upon which capitalism relies. So trans people often, but not always, seek healthcare services related to their experience of gender incongruence or dysphoria. Exactly what is required and when is individual to the trans person, but it could take the form of hormone therapy, reconstructive or cosmetic surgery, voice training, counselling. Gender affirming care is associated with increased quality of life, decreased anxiety and depression, and has very low regret rates. This is the experience of trying to access that care. You get a referral to a gender identity clinic. You then wait for roughly 5 years. You then are seen by the gender identity clinic, who will then possibly prescribe you things. This process, apart from the extremely long waiting times, contains often includes invasive and inappropriate questioning of a sexual nature, cis-sexist and heteronormative assumptions about gender presentation, poor communication between the GIC and the GP, and requires huge concerted effort on the part of the trans person to get past those gatekeepers to that gender affirming care. So at the time of this presentation, so March 2020, no, well, it was March when I wrote it, April 2022, the GICs are offering first appointments to the people who referred to their service in December 2017, and there are over 10,000 people on their waiting list. So you might be forgiven to think that that would mean that the service was increasing in size, and that is not happening. Despite increased funding, so that top line is the waiting list, but the funding has also gone up over that time. The number of first appointments offered each month has either not changed or fallen since 2017. This is data from Tavistock and Portman. The GICs are not growing to meet demand, and they're not providing transition-related care. I think it's really important to note that there's nothing particularly special about these surgical or medical methods that trans people seek to access. Most hormones and other interventions required by trans people are manufactured or developed with the assumption that they are used for stabilizing gender sex rather than for gender sex transition. So, hormones that used to help people going through the menopause, for example. Testicles removed because of testicular pain. Mastectomies are provided to either treat or prevent breast cancer. And even genital reconstruction is not a uniquely trans phenomenon. Phalloplasty and vaginal labiaplasty are used to treat a variety of conditions in cis people, including relieving psychological distress or for cosmetic purposes. Can those be described as anything other than gender affirming surgery, even if that is an affirmation of the sex assigned at birth? All these affirming procedures are, as demonstrated, extraordinarily difficult for trans people to access. But it's not the medical or surgical technique that differs between those cases, it's the gendered positionality of the patient. In Britain, under our current conditions, the gatekeeping of trans healthcare functions as the gatekeeping of transness itself. And so that tension that I referred to in the first slide is between the existence of trans people and the construct of the gender binary. The immutability and differentiation of the sexes and their reproductive and domestic roles are safeguarded, and any attempt to undermine this order is firmly opposed. You can see it in relation to homosexuality, the treatment of intersex children, and the debate around equal marriage. And the GIC model exists to prevent easy access to transition-related healthcare. The history of transgender healthcare fits with this finding. Early kind of sexology, which is where doctors were kind of seeking to describe and categorize the deviant behavior of those who failed to conform to norms of sex and gender. The crisis of sex in the 1950s, where biology and medicine had sort of researched the plasticity of sex to such a point that they were lacking a rationale for the sex binary altogether. Transsexuality has always been something to manage and control. Binary transition, so from one sex to the other, was promoted as the only acceptable model of transition, and that position has not meaningfully changed, as experienced by non-binary people trying to access gender-affirming care through the GIC model. But gender non-conformity exists beyond this medicalized understanding. History tells us that LGBT and T are not stable nor discrete categories. So trans liberation, as shown by this understanding of Marxist feminism, is contingent on the destruction of that gender binary and heterosexuality as a system of social organization. It will not be possible to have trans liberation without that destruction, because capitalism will always seek to uphold these two immutable binary categories. But what would it mean for that binary if hormones were easily accessible, alongside medications like paracetamol or diphenhydramine, which is Mitol, potentially dangerous if you use them irresponsibly, but yet they're used safely by millions of people every day without the need for institutional surveillance? What would it mean if we were able to truly explore the mutability and plasticity of sex and gender through any means that we desired? The end of gatekeeping would perhaps be the opening of the floodgates, but not only to new possibilities of gender expression, but to a liberation from gender-based oppression entirely. Thank you very much. That is the end.
Wonderful. Thank you for, I feel like I'm always saying this, for another really interesting paper. Perfect. So